STIs and TB research program at the Human Science Research Council. Professor, thank you very much for joining us. Very good evening to you and welcome to the Globe.
It's a pleasure. Thank you for inviting us.
And I mean, having gone through the report, where are we in terms of meeting global HIV targets?
I think we are making great strides towards reaching our goals, the 1990 targets, as the results of the report have shown, and as well as the great work that has been done at ESHO, at the community, the very local rural community, that has shown that if we target our resources down to the communities and work with communities, we are able to make inroads towards reaching our targets. And ESHO has actually reached the target of the 1990 target that we hope to have reached as a country by 2020.
And what do you attribute the great strides that have been taken insofar as fighting HIV and AIDS?
It is basically the change in how we work. You know, we need to look at HIV beyond it being a disease, but we need to involve communities, bring the human aspect of the HIV and AIDS epidemic. And also what has contributed more is actually putting more people into treatment, as those that know that they are living with HIV. However, we still have a challenge as a country that not many people know their HIV status, but the results show, and the research has shown, that actually those that are put on treatment, they actually live longer, and they actually go to the stage of being virally suppressed, which is what we want in the terms of our 1990 targets.
And having said that, Professor, the pace of reducing new HIV infections and accessing treatment is decreasing. I mean, this is a slap in the face for anti-AIDS efforts. It
is concerning. If you look from where we come from, I think there is some sort of an element of complacency, both from the society and also from the funders' perspective also, because the funding itself it's dwindling, and this is not the time that we can actually take our foot off the pedals at this stage. And also the fact that, you know, if you look at how the numbers have been going down, it has been declining, the numbers of people that you know, recently infected with HIV, but the rate is not as fast as we want, and actually the rate is still high enough to sustain the epidemic. So we still need to be more aggressive in putting more resources and working with communities to make sure that actually we can even begin to speak about ending HIV epidemic.
You're calling for aggression, but then the report shows that the increasingly widening gap between funding mechanisms and, of course, the available resources remains huge. And I guess all those anti-AIDS efforts, I mean, am I correct to say that all these anti-AIDS efforts are devoid of political will on the part of the government, not just in South Africa, but globally?
I think that is what we've seen happening globally, that actually political will seems to have been shifted or been diverted somewhere else, which is not what we need. However, I must say we are encouraged by what we see, especially in South Africa, more so after the recent South African AIDS conference, where we see a reinvigorated, you know, attention to HIV/AIDS epidemic, and also to see more and more politicians showing that actually there is a lot more that needs to be done. So that attention, we actually seem to be getting it back, and we need to emphasize that. So when I talk about, you know, reinvigorating our attention to HIV and AIDS epidemic, is to move away from what we have been seeing to be going on, but change, you know, the direction and focus more on putting more resources that are aimed at curbing the spread of HIV epidemic, especially among young people, youth, where we've seen that a number of them, or the recent infections, are much higher in that age group, 15 to 24 years of age.
Not just the youth, but poor people as well. We've seen the Deputy President, David Mbuza, saying that poor people had the highest risk of infections. And I'm curious to know why, though. Why is this the case? Because there is information galore all over the place. I mean, anti-HIV information is available on every platforms, even at the remotest of places in South Africa.
Certainly, but remember, poor people also access to facilities, they might be far away from them. A person might have a sexually transmitted infection, that which, if a person was closer to a facility, would have gone there immediately. But because of other resource limitation, it takes time for a person to get there, and there are other also competing challenges in terms of do I spend this money, the last rand that I have to buy food, or do I go to take a taxi to go to a health facility? So also poverty in a way plays a big role in terms of access, partly in terms of access to facilities that would help deal with HIV epidemic. So we need to go to the communities in terms of bringing services to the communities, bring education to communities, and this example that we've seen in Eshowe, for example, and that has happened in other countries such as Zambia, where if communities are involved, we see a lot more impact happening than when we are a bit distant from what is happening at grassroots levels.
And then there's this proverbial elephant in the room, the issue of stigma. How on earth do we deal with it? I mean, we've been trying all these years to deal with to fight against the stigma and stigmatization of those affected and infected by HIV and AIDS, but we seem to be losing the battle. I mean, is it an issue of confidentiality, accessing HIV treatment, for instance? People are so scared, or is it an issue of naivety?
We think we have conducted research at Human Sciences Research Council to look at the levels of stigma. What we found was that the externalized stigma, as the levels have gone down, people have learned to live with HIV and AIDS. However, another component of stigma is what we call internalized stigma, which is the perception, what people think about me if I go to a facility and I test HIV positive. So we have a responsibility as a society to keep on, embracing, talking to people that are living with HIV and showing that actually you can live positively with HIV, and providing support, and also ensuring that they get the services and the resources that they need in the way that they need them. And also the other part that we need to address as a society is to deal with HIV/AIDS epidemic among key populations, yes, which is another component, as the report has shown, that more than 50% of the recent infections globally actually are among key populations, be it men having sex with men, transgenders, commercial sex workers, and also injectable drug users. So we need to pay attention to those, as that is becoming another challenge. And also, given the fact that these are marginalized communities and sometimes they are stigmatized, and we need to change the perception in our society.
Are you happy, though, with the pace at which we are in terms of fighting HIV and AIDS? What more needs to be done, if at all?
I'm happy with the fact that we're seeing some light in terms of reducing the numbers of people dying from HIV and AIDS, but I'm not happy at all with the pace at which we are moving, and I'm not happy at all with the rate at which or access to resources. As you can see, to be able to conduct this work at local level and deal with communities, it requires a lot of resources, be it financially, and human resources are needed. And this, to rely only on the international dollar funding, which is dwindling, is a big challenge. So we need, as a country, to take responsibility, and also we call upon our international, the funders, to say this is not the time to leave us alone. We need them more than ever before.
I mean, how do you take away that political element towards international funders? Because some of the funders may look at the political situation in that country and, it may actually affect their decision in a way towards funding to that particular country.
HIV and AIDS, it's a human rights issue. So be whatever the political situation in any country, HIV, the right to life, it's a human rights issue. So I would say, irrespective of whatever political situation we have, or the international community, the donors, or whoever, we have a responsibility to provide support and make resources available to make sure that we turn the cap around the HIV and AIDS epidemic.
All right, Professor Zuma, thank you so much for your time.
You're most welcome.
All right, that was Professor Khangelani Zuma, the Executive Director of the HIV and AIDS, STIs and TB Research Program at the Human Science Research Council. This is the Global SAP.